5 non-clinical topics that show up on the FNP board exams. Clinical questions, cardiology, respiratory, endocrine. Those are the ones that people study, right? And then on Thursday, you enter the exam and you see some of these non-clinical questions and you'll be like, is this Greek or are they trying to trip me up? So it's important because I always emphasize with students, if you don't follow up, study on the non-clinical section, you are leaving some free points on the table. So you don't want to do that. And as you start practicing, you also realize that, yes, the non-clinical part of the profession is also what you should know, because so that if you start saying, oh, I didn't know, that would not, help you in the course. So hello, I'm Miriam, Nurse Practitioner. I do MP study, a guide and study courses for FNP students, studying to take the FNP board exam. Welcome to the MP Exam Prep YouTube channel. So this is how some of the scenarios about the clinical, non-clinical questions will be presented. And, as you already know, the ANCC exam is weighted heavily on the non-clinical exam. And yes, the AANP also have sections there. People don't believe it, but yes, it does have some sections that are correlated with non-clinical exam. So let's go. So number one of the non-clinical practice topic we're talking about today is scope of practice. The question will not come asking you what is scope of practice. Okay, they will put it in a scenario and it's left for you to answer the question correctly. For example, I'm going to read my questions here so I don't make any mistake. By a nurse practitioner in a rural clinic, a patient presents with a new onset focal neurological symptoms. The nearest neurology or emergency room is about 90 miles away. The patient asks if you can manage this yourself, since it's inconvenient to her, to travel. She doesn't have transportation. It will cost her a lot of money to go to the nearest emergency room or nearest neurology. So the question will be asking, what do you do? So the wrong answer will feel compassionate. You might say, oh, monitor closely and follow up in 1 week, but you will know what will happen, right? So the right answer is the one that acknowledges your limit. So you refer to neurology or emergency room. In this case, it's an emergency room, right? Because a lot of neurologists that will know it will take 3 months to see them. So to me, patients like this, I just refer them to emergency room because they can also bring neurologists to see them, right? So the pattern, anytime a scenario creates pressure from the patient, the situation, or the convenience to add beyond your training, the answer is always to refer that care or to escalate it. So the board is not testing your flexibility. It is testing your judgment, clinical judgment. Delegation. The delegation questions show up more than people expect. And the answer logic is very specific. There is one rule that unlocks almost every delegation. Do not delegate anything that involves clinical judgment, right? Here is how it's presented. So I'm reading the question. You are FNP supervising a busy clinic. Which of the following tasks is appropriate to delegate to a medical assistant? Answer option number 1, administering a scheduled vaccine to an established patient. Option B, assessing whether a patient's wound is healing appropriately. Option C, counseling a patient on insulin injection technique. Option D, deciding whether the patient's vital signs require providing notification immediately. So the correct answer is what? A. Because B requires clinical judgment assessment, so you will not delegate that. C requires clinical teaching judgment, you will not delegate that. D requires clinical judgment, clinical decision making, you will not delegate that, right? So the pattern, if the task requires the persons to assess, interpret, evaluate, or decide, it belongs to the provider. If it's not a procedure or a task with a clear protocol, it can not be delegated. So make sure if it's not a task that is not clear, you need to look into it. Don't just be telling people what to do because at the end of the day, they're under your license. If they go and do something wrong, it comes back to you. So real quick, if you want to practice these non-clinical types of questions, don't forget to check out my 300 question bank that covers both the AANP or the ANCC. Okay, so including the professional role domain. So link is in the description, again, at mpexamprep.com. So back to it. So non-clinical topic number 3, ethics. The ethics questions are the ones that people feel like there's no right answer. Oh my goodness, do I need a law degree? People start getting scared, right? But the 4 principles that guides ethics is the autonomy, right? The patient's right to decide, the beneficence, doing good, non-maleficent, avoiding harm, justice, fair treatment for all. Autonomy comes first in most scenarios unless following it would cause significant harm. So here is how it's presented. A competent adult patient with newly diagnosed type 2 diabetes refuses insulin and states they prefer to manage their condition with diet alone, despite their hemoglobin A1C of 11.2%. What is the most appropriate response? So option A, initiate insulin injection anyway, given the severity of the A1C, because you are the provider. B, document the refusal, respect the patient's decision after thorough education. And of course, all of that is documented. And the follow-up is also scheduled, right? C, refer the patient to endocrinology without further discussion. D, discharge the patient from your practice. The answer is what? B, document the refusal, respect the patient's decisions, explain everything and make sure you in detail, not say, oh, education provided. No, provide detailed documentation about what you said and even the patient's comments, right? The patient is competent. So autonomy is the governing principle. Your job is to educate, tolerate, document clearly, and respect the decision even when you disagree with it. So the pattern, competent adult plus informed refusal equals to respect autonomy. Document everything. So the AANP and the ANCC both test this consistently. Topic number 4, or non-clinical topic number 4, legal and liability. Legal questions make people nervous because they feel like you need a law degree. You don't. You need 3 concepts. Concept number 1, standard of care. You adhere to the standard of a reasonable, competent FNP in the same situation, right? Not a physician, not a specialist, a competent nurse practitioner. Concept number 2, mandatory reporting. You are required to report suspected child abuse, elder abuse, some certain communicable diseases, gunshot wounds in most states. I wasn't sure it's not a good defense, right? Which is why it's very important wherever you are practicing, you want to be familiar with the laws, what to do. What do you do in these situations? So concept number 3, informed consent. Consent is not a signature. It's a process. The patient must understand the procedure, the risk, the alternatives, and then have the right to refuse. That's what informed consent is. Not just say, okay, sign here, sign there. No, that will not help you in the court of law, right? So here's how the legal questions are presented. A nurse practitioner performs a procedure on a patient who signed a consent form but later states they did not understand the risk explained. The patient develops a complication. What is the nurse practitioner's primary liability concern? The answer points to what? Informed consent being a process, not a form. Signing a paper doesn't equate understanding. The pattern. Legal questions test whether you know your obligations. Reporting, consent, documentation. When you are not sure, the answer that protects the patient and creates a clear record is almost always the right answer. Topic number 5. So cultural competency questions are the ones people get wrong because they overthink them. The boards are not testing whether you know specific cultural practices. They are testing whether your approach is respectful and patient-centered, even when you disagree with them. So here is how a question will be presented. Here's how a question will be presented. A patient from a culture where family members traditionally make medical decisions declines to discuss their diagnosis directly. I ask that you speak with your adult son instead. What is the most appropriate response? A. Explain that you are legally required to discuss the diagnosis with the patient directly. B. Respect the patient's wishes and speak with the son with the patient present. C. Insist on speaking with the patient privately before involving family members. D. Document that the patient refused information and proceed with the son. So the correct answer is what? B. Respect the patient's wishes and speak with the son with the patient present. So the patient, a competent adult, is exercising their autonomy to include their family in their care. That's their choice, not a violation. The pattern, cultural competency answers center on the patient's expressed preference. The wrong answer impose your framework on their values. You do not do that, right? If the patient is competent and making an voluntary, informed choice about how they want to receive their care, we are supposed to honor that, okay? So let's recap the 5 non-clinical topics and the pattern for each one. Scope of practice, when there's pressure to act outside of your lane, you try to refer them out, not try, but make sure you refer them out or escalate care. Don't just keep them there when they're not improving and you know very well is going out of your scope of practice as a nurse practitioner. Delegation. If it's just some tasks, yes, but if it requires judgment, no, do not delegate. Ethics number 3. Autonomy first. Unless it causes significant harm, then you document everything. 4. legal and liability. Know your mandatory reporting obligations. And remember, consent is a process, not just a signature. And know the legal requirements for you as a nurse practitioner in each state that you are practicing. Then number 5, cultural competence. The patient's expressed preference is the right answer, not your default approach. Okay, even though it might be wrong or you might feel like this is not what you know to do. So these 5 chapters together cover the bulk of what both the AANP and the ANCC test in the non-clinical domain. And if you want to log this in with practice, I have 2 resources in the description. My 300 question FNP question bank, both star questions for both exams, including this whole professional role domain. And you can also check out the FNP board exam buzzwords guide. Again, all of these resources are found at npexamprep.com. Okay, tell me in the comments which of these 5 trips you have the most. I read all the comments. So you can like the video, subscribe, share with each other. I'm here with you. We're going to continue this journey. You're going to get your FNP and start practicing. See you in the next video. Thank you for watching. Bye-bye.